Hi, I'm Dr. Kerry Gelb, and welcome to Open Your Eyes, your source for everything you want to know about eye care.
Well, ocular migraines there's two different types. So technically there's ocular migraines and there's visual migraines. So a visual migraine would be more of a complete visual, like that occurs in your brain. When we talk about ocular migraines, typically that has to do with more in one eye, and usually that's because of a spasm in the back of your eye. So, that's the current theory behind it. But as far as when that occurs, what's causing it, the debate's still out on that. It's not exactly certain. So typically with an ocular migraine in one eye or the other, you're going to have symptoms of vision loss. Like all of a sudden it might go dark. You might have some pain in the back of your eye. Typically what we're worried about with that is that it can be a sign of more things to come. So it could lead to more permanent vision loss. So in those cases, it's something that you definitely want to get checked out. But as far as the causative factors behind it, it could be from diabetes, it could be from damage, it could be from trauma. There's a lot of things that could cause it.
Are ocular migraines always indicative of something else, or are they?
Not always. Sometimes they can be idiopathic, that means that there's no known cause to it. So sometimes they can just occur for unknown reasons, and sometimes there can be an underlying reason, some kind of underlying issue, something that we need to take a very close look at to find out.
So when do I go see my OD?
So if you have an ocular migraine, which would present, it's going to be in one eye or the other, or you're going to see, sometimes you can see what's called aura, which is like, a show of like colors. It can present in a lot of different ways, wavy lights, things like that. If you experience that, even one time, it's definitely something that you don't want to just ignore. But I'd say, maybe once, if it happens once, that's not the end of the world. But if you ever experience that again, it's definitely something we need to take a look at. Diagnosing one, I guess really, that's something that's the patient's explaining to me. It's very subjective. A patient's going to experience that, and if they describe it to me, they're going to let me know that they're experiencing symptoms going along with this, and really it's kind of a process of elimination. So if you tell me you're having these visual symptoms, you're noticing pain in one eye, you're seeing different signs of it, and I look inside your eye and I don't see anything, then I'm going to take the next steps and see what's going on underneath that. But
And what is there a treatment for it, or is it again depending upon the variables?
Depending upon the variables, usually the treatment for that's going to be treating the underlying cause. So if there is some kind of issue, high blood pressure, for example, and you're having there's changes in the blood vessels in the back of your eye, you're going to want to treat the blood pressure because that should take care of it. If there's something else going on, if there's some anomaly, or there's some underlying issue that is a little more invasive, we're going to take the next steps to get you to the right spot, the right doctor to take care of that.
Okay, so elaborate on that. That sometimes we need to go to other professionals in the business to cross reference or.
Yeah, of course. So I as an optometrist, I deal with the eyes. So if I look back there and I see that you have hypertension or something going on that I'm worried about, that's say maybe something that corresponds to a neurological issue, I'm going to send you to a neurologist to assess it, see what we need to do, or I'm going to send you to your primary care doc to see about blood pressure. I'm going to correlate those things, and I'm going to get you to the right spot so we can take care of it as quick as possible. So the most common causes of ocular migraines, a lot of times it's something to do with spasms in the back of your eye. The blood vessels back there can spasm, and it usually has to do with blood pressure changes. So it could be, related to high blood pressure, could be related to low blood pressure, it could be related to sudden changes in it. Currently that's the biggest one, but it can present from other issues too. It can be more neurological. It can be something that's going on in your brain and causing you to see different kind of sensations, and a lot of times it can, come before a migraine, a full-on migraine. So your triggers, there's a variety of different things that can cause it. A lot of times, if you experience migraines, you're going to know kind of what is your trigger. It could be stress, could be different types of foods. And when you experience those, a lot of times an ocular migraine can come before a full-blown migraine, which can be pretty debilitating if you've ever had one. Color blindness, also known as color vision deficiency, that's basically a loss of your ability to discern colors or to see certain colors. And usually it's not a complete loss of color vision, it's just your inability to kind of tell the difference between certain shades. So actually it's one of the most commonly inherited deficits like that. So I'd say that statistic currently is about 8% of males actually suffer from some form of color blindness or other, and about 0.5, half a percent of females suffer from it. So, you know, your kid has a 1 in 15 chance actually, if they're a boy, of having some form of color deficiency. So especially early in life, you know, that's one thing that can really affect you. Examples of issues from it could be, you know, you'd have a hard time picking out ripe fruit. So you could pick up an apple and it could be, you know, spoiled, but it's hard to kind of tell the difference aside from the texture of it. You could also have a hard time seeing traffic lights, seeing different types of, you know, flags on a field, things like that. You know, telling the difference between red and green is the biggest part of that. So, and that's the most common one that we come across.
How do you know if you're colorblind? How do you know if your child's colorblind?
So one thing that may happen if you notice that your child's colorblind is they could say, you know, they may be saying that they see a different color. They're describing colors differently, or you may notice if they're dressing themselves, if they get to that stage, that they're actually, the colors don't match or they look weird, you know, things that you typically wouldn't associate together. Very subtle things like that, you can pick up on it. Or, you know, if you describe a color as very vibrant and they don't really kind of notice that. Really, it would be subtle at first, but as they get older, it's one of those things that, you know, they could kind of express to you as they learn that they should be seeing things a little bit better. But, you know, a lot of times in, you know, younger children, especially for their first exam, that's one thing that I'll pick up for the first time, that the parents actually won't know that.
Is there anything you could do about it?
There's not really much you can do about it. You know, for red-green patients that are red-green colorblind, sometimes, you know, they do have certain types of lenses that can help you discern the difference between colors a little bit more. As far as bringing back your ability to see that, though, you know, you actually have a lack of those certain types of receptors in your eye, so you really can't bring that back. But, you know, we can definitely, if we find out early enough, we can definitely give you some glasses that may help a little bit. And the biggest part about that, I think, is that you can actually talk to your teachers and express to them, you know, this is what's going on, this is the situation, and in certain cases, you know, they may change their teaching style so that your child doesn't lag behind others, because that definitely can be a big impact on their life.
So the therapy is really acceptance and lifestyle adjustments?
Pretty much, that's the biggest thing that you're going to go through for that, is just knowledge, education about it, you know, talking to people that are interacting with your kid all the time. There's really not a lot you can do to treat that underlying issue. Is it a sign of something more to come? No, I wouldn't say that it's a sign of that. You know, sometimes you can get color vision loss from certain types of medications. You can get it from brain damage, things like that. You know, and in that case, you're definitely there could be more things coming on from that. You know, more things happening, more complete color vision loss. But usually, oftentimes, when we see this in children, once they, you know, that's a lifelong thing. So they're kind of born like that. It's not something that's going to get worse as the years go by. It's not going to change things. In rare cases, you know, if you are completely colorblind, in those cases, there's other things that go on a lot with it. It's very rare for you to completely not be able to see colors, you know, which is what we call a monochromat, where it's basically everything's a shade of gray. In that case, you know, usually there's something else going on, a very high light sensitivity. You know, you have a hard time looking at bright lights or anything like that. You notice that a lot too.
So colorblindness is pretty much a standalone syndrome, whatever you want to call it. It's not usually parallel with something else going on.
So you mean
connected to something else?
Some other diseases?
Yeah.
No, typically it's its own thing. You know, I would say that color blindness doesn't always go along with something else. You know, there's not something else necessarily involved with it. Usually it's a standalone thing, but you know, that doesn't mean that it won't occur with other certain conditions. Yeah, so I would say, you know, if you think your child has color blindness and it's something that you want to get tested, you know, that's definitely something we need to check out, because there's things we can do to make his life easier and, you know, address things, and cutting that off ahead of time, you know, we can actually, you know, deal with that, or, you know, driving, traffic lights, things like that. If it's something that all of a sudden you think you've experienced color blindness, you know, it's just occurred, then that could be a sign of something else going on. You know, it could be a big issue with something like, if you were taking a medication, or it could be a sign of some underlying neural cause. And that's something you definitely need to come in right away for.
Thank you for watching Open Your Eyes. Be sure to tune in for more informative episodes.